My name is Simon Newman. I am a consultant orthopaedic surgeon with a specialist interest in hip surgery. So I think looking back, why I decided to become a doctor really came down to being brought up with the expectation that you're going to help people. It's something that was drilled into me from a really, really young age. It was a big part of my upbringing. My mother ended up being a priest, and we were just used to helping other people really throughout our sort of school years, and that combined with an interest in science and how the human body works really pushed me in the direction of medicine as a career. So I chose to become an orthopaedic surgeon for a number of reasons. So one of those is that I get to treat a whole variety of different people. So I'm very lucky that nowadays I can treat people from adolescents, so 12 upwards, right the way up to people, who are over 100. I can treat men and women. And I think what I find really special is that you can make a massive impact to people's life. So their quality of life can be really improved by the sort of interventions that I can offer. And the other bit is that we get to use a whole lot of really interesting kit. There's lots of technology, there's lots of research and development in this area, and we're able to offer more and more things to our patients to get them to recover faster and have better outcomes. And it's a really, really interesting field to be in. So, I think the rewarding thing, or the really rewarding thing about the job is, particularly after you've had a patient really, really struggling with pain associated with their hip, you do an operation on them, and then you start seeing them back in the follow-up clinics. Even within a week or two following the operation, you've made a massive difference to their life. So you see some people who are pitching up in wheelchairs before they have their operations, and then by the time they're coming back 2 weeks or even 6 weeks down the line, they're able to walk around with minimal assistance, and that's so rewarding. You can see the difference. It's very, very different to some of the more medical fields and things like that. We have to wait and see the responses that people get. We get a very rapid change and a rapid improvement in how people do. So I think that from the feedback that I've had from patients, the thing that they value is that I have quite an informal style. So I try and come across as being friendly and approachable. And the other aspect of it that I think is really important in your surgeon is you want somebody who is going to be diligent and precise. And those are the things that I concentrate on and pride myself on. I think in terms of what I get from the patients, it's the interest, it's the stories, it's what people tell you, it's learning about different people's lives. That's not just about their recoveries from the surgery, it's just in general interesting to meet lots of different people who've had lots of different experiences. But it's hopefully a positive two-way interaction, be able to go through a treatment process. So I'm not sure they're really mantras or catchphrases as such, but I think the thing that drives what I offer to patients and how I discuss things with patients is, putting myself in their shoes, or imagining what I would offer to, one of my close friends or members of family in terms of how I treat them. And I wouldn't want to offer anything or undertake an operation on someone that I wouldn't want to offer to one of my friends and family. And that's basically what it comes down to.